imagine that this patient is entering your hair clinic and tells you he wants to have his whole recipient covered. You quickly realize that, for example, his donor area is quite small because you can only harvest in the safe zone area, and this safe zone area is actually not like in normal cases. It's quite small because you can see on the image that it's already miniaturizing. So now the job is to educate the patient. First of all, of course, explain to him why, for example, a specific number that he has in his head is not possible, for example 5,000 grafts, plus it makes sense to probably don't cover the vertex or only cover the vertex. And I will show you just one example how to do that with the Transplanner software. So let's just jump into it. First of all, of course, you see a lot of statistics. We won't focus on this. The only thing that's important that you see here that the patient only has 8% of triple and bigger follicular units in his donor area. When we go now into the patient view, that's the view where you want to educate the patient and in a way also sell the surgery, you will show him right now what happens when he, for example, wants to have 50 or even more percent of coverage out and say, okay, we can even harvest 6,200 grafts on you, right? And you will say, great, let's do it. But you can say, look, this is how you look after the surgery. These micro images actually are from his temporal and occipital area in his donor. So you can ask, do you want to be bald after the surgery on the sides? The patient will probably say, no, not really. So you can say, okay, I will give you all your hair back. So you can do it also a little slower and say, okay, let's have a look on what is the best scenario for you. So you already know that his donor is weak because of the triple and bigger follicular units and the low number. So you wouldn't harvest more than 30% on this case. So you would say, okay, let's get roughly 30% coverage difference here. It's like 32 and 31, it doesn't matter right now. And you would get 2,300. So you can say, tell the patient, look, this is how you would look after the surgery on the side. You can also explain that actually all the hair that you harvest is gone. A lot of patients don't know this fact. So you can show this also nicely in this software. Plus you can educate and say this would be the perfect surgery in terms of safe surgery. Of course, if the patient is asking you what is the maximum number, you can even go to 50% and say, okay, maximum number would be roughly around, let's say, 4,000 grafts when you harvest 50%. More than 50% is actually almost a crime. So you can explain to the patient 50% is the maximum number of grafts, but let's focus only first on the surgery on 30% and see what we can do with 30%. We have another patient view to educate the patient, and we distinguish between, of course, the hairline, the frontal part, the mid-scalp, and the vertex. Why? Because we talk here about insertion density, so grafts per square centimeter. That means in the hairline, we always insert 50 to 55 grafts per square centimeter because, as you know, it's single graft. So for example, in this case, in the frontal part, you also insert double grafts, so you can't go as close together. So let's say here we can only go to 45. I'm not a doctor. I'm just explaining to you right now how we can use the software. In the mid-scalp, we already will use a couple of triple units, so we shouldn't go over 35 grafts per square centimeter, but again, you can decide it yourself. Now, of course, the vertex. In the patient's case, it doesn't make sense to use the vertex, and you can just say, okay, I will turn off this area here. So what you're going to do, you just turn it off and you can explain to the patient that this is the graft number that you would insert. And the availability is 2,300. So you can say, okay, you can decide which number he should pay for. But for sure, you can explain we have a little bit more grafts available. So you will see how his skin reacts and then you sell him the surgery. And this is how you can nowadays consult the patient when they have some questions, plus if they have a completely crazy number of grafts in their head. Let me know in the comments what you think.